Health is more than just the absence of disease. It's a state of complete physical, mental, and social well-being. Understanding the factors that threaten this well-being is crucial for improving global health. This is where the Global Burden of Disease study comes in. The GBD study is a comprehensive effort to quantify the impact of diseases, injuries, and risk factors on populations worldwide. It provides a detailed picture of the leading causes of death and disability. This information is vital for guiding health policies, allocating resources effectively, and developing targeted interventions. The study analyzes data from numerous sources, including health surveys, vital statistics, and hospital records. It considers factors like age, sex, and geographic location to provide a nuanced understanding of health disparities. By examining trends over time, the GBD study also helps us track progress in combating specific diseases and identify emerging threats. In essence, the GBD study serves as a global health report card, providing valuable insights into the health challenges facing humanity. It allows us to understand not just what makes us sick, but also what keeps us healthy. Epidemiology, the study of disease patterns in populations, is fundamental to understanding and improving public health. It provides the tools and methods to investigate the causes of disease, track its spread, and evaluate the effectiveness of interventions. Epidemiologists act like detectives, searching for clues to understand why certain diseases occur in some populations more than others. They collect and analyze data on a variety of factors, including demographics, lifestyle choices, environmental exposures, and genetic predispositions. By identifying risk factors, epidemiology helps us understand who is most vulnerable to particular diseases. This knowledge is crucial for developing targeted prevention strategies and public health campaigns. For example, understanding the link between smoking and lung cancer has led to public health campaigns aimed at reducing smoking rates. Epidemiology also plays a vital role in evaluating the effectiveness of health interventions. By comparing the health outcomes of those who received an intervention to those who did not, epidemiologists can determine whether the intervention was successful in improving health. To grasp the true impact of health problems, we need ways to measure their occurrence and severity. Two key measures used by epidemiologists are incidence and prevalence. Incidence refers to the number of new cases of a disease that develop in a population over a specific period. It tells us how quickly a disease is spreading. For example, tracking the incidence of COVID-19 cases was crucial for understanding the speed of the pandemic's spread. Prevalence, on the other hand, represents the total number of people in a population living with a particular disease at a given time. It provides a snapshot of the overall burden of a disease in a community. For chronic conditions like diabetes, prevalence is a more useful measure than incidence for understanding the long-term impact on healthcare systems. Beyond measuring the occurrence of disease, it's crucial to assess its impact on individuals and society. This is where the concept of the burden of disease comes in. The burden of disease considers not only mortality, deaths, but also morbidity, illness, and disability caused by a condition. Section 4. The course of disease from cause to consequence. Every disease follows a natural history, a progression from its initial cause to its eventual outcome. Understanding this natural history is crucial for developing effective prevention and treatment strategies. The etiology of a disease refers to its underlying causes. These causes can be complex and often involve a combination of factors. For instance, heart disease is not caused by a single factor, but by an interplay of genetics, lifestyle choices like diet and exercise, and environmental exposures. Once the disease process begins, it progresses through different stages. In the early stages, there may be no noticeable symptoms. As the disease advances, symptoms become apparent, and complications may arise. The final outcome of a disease can range from full recovery to disability or even death. Understanding the natural history allows healthcare professionals to intervene at the most opportune time. For example, early detection of cancer through screening can significantly improve treatment outcomes. Section 5. Cause and effect, distinguishing association from causation. One of the fundamental challenges in epidemiology is determining whether an observed association between a factor and a disease represents a true cause and effect relationship. Just because two things occur together doesn't mean that one causes the other. An association simply implies that two variables are related in some way. For instance, we might observe an association between ice cream sales and drowning deaths. However, this association doesn't mean that eating ice cream causes drowning. Causation, on the other hand, implies that one event is the direct result of another event. To establish causation, rigorous scientific criteria must be met. These criteria often involve demonstrating a temporal relationship, the cause must precede the effect, a dose-response relationship, greater exposure leads to a greater effect, and biological plausibility. A biological mechanism can explain the link. Distinguishing between association and causation is crucial for developing effective public health interventions. While an association might point to an interesting trend, it's the establishment of causation that allows us to develop targeted interventions. Section 6. Identifying risk. Uncovering the factors that influence health. Risk, in a health context, refers to the probability that an individual will develop a particular disease or experience a health event over a defined period. Identifying risk factors, those characteristics or behaviors that increase the likelihood of developing a disease, is a key aspect of preventive medicine. Risk factors can be modifiable, meaning they can be changed, or non-modifiable, meaning they cannot be altered. Age is a classic example of a non-modifiable risk factor. As we age, our risk for certain diseases such as heart disease and cancer naturally increases. Lifestyle factors, on the other hand, represent modifiable risk factors. Smoking, lack of physical activity, and an unhealthy diet are all modifiable risk factors that contribute to a wide range of chronic diseases. By identifying and understanding risk factors, both at the individual and population levels, we can develop targeted interventions and public health campaigns to mitigate those risks and promote better health outcomes.